Hi, I'm Dr. Farley, and today I want to talk about the question, are you a candidate for dental implants? We get a lot of people who come to see us for a consultation. They were told at some point, or they believe that they are not a candidate for dental implants. The reality is that most people are actually a candidate, and if you were told otherwise, it could just be that the person you were talking to doesn't have the same experience. Maybe they're newer in their journey, or they're looking for the cases that are a little bit more straightforward. So I want to go through this with you. I want to talk about some of the common reasons people feel that they are not a candidate for dental implants. First one is age. That's an easy one. The reality is if you're too young, that might be a real contraindication to dental implants. When you're still growing, you don't want to put a dental implant in because the implant's going to stay and the other teeth are going to grow around it. And that can cause some problems. And so we typically recommend that you be done growing before the dental implants. So if you're a teenager and you've lost a tooth or you never had that tooth, my recommendation is to wait till you're 19, 21, longer if you're a guy, but waiting until you're completely done growing, then get the dental implant. But when it comes to the upper end of the age discussion, there really is no contraindication. Just to give you an example, we had a patient back in March, just a few months ago, and he had all of his upper teeth, lower teeth removed, implants in, attached teeth, and he's healing beautifully from it. And he had that procedure done on his 95th birthday. If that speaks at all to the fact that age doesn't matter, what else does? Just know that age is not a contraindication unless you're too young. The next one is bone. That's probably the most common reason people are told they're not a candidate for dental implants. If the person doing the procedure is not comfortable doing some of these extra things, then yes, maybe you are a contraindication in their hands. Usually the discussion is if you don't have enough bone, either we need to look to a different place or we need to try and create bone in the area. If you don't have bone, some of the most common reasons for us to help you still get dental implants. One of them is going to be grafting. To be able to put bone into an area, wait for your body to grow its own bone through that graft, now suddenly you have more bone. Another one that is commonly done is if your bone is too thin, and it's so thin that you can't even fit a dental implant in, we can actually take that bone and push it apart, put the implant and some graft in, and actually widen that ridge. There's another type of implant that not too many people offer, but we do here, and it's called a subperiosteal implant. With subperiosteal implants, the concept is to spread out the force. So the implant doesn't go in the bone where the bone fuses to the implant. The implant is made to sit on top of the bone, but to spread out the load over a wide area to distribute those forces. But you can still avoid partial dentures and dentures utilizing a subperiosteal implant. So not having enough bone is not a reason to not at least get that 3D x-ray and start having the discussion on what your options are. The final one is health concerns. That could be your health conditions, it could be medications that you're on. One of the most true, real contraindications has to do with diabetes. Now, it's not being diabetic that's the contraindication, it's not controlling your diabetes. If you are regularly getting blood work to check your A1C, just know that you want that A1C to be below 8. To be able to do dental implants, you want it to be ideally below 7 would be even better. If you're above 8 though, you really shouldn't be considering dental implants. Your body is just not going to heal from anything. Doesn't matter what you have done to you, you're not going to heal from it if your A1C is above 8. Either using medication, diet, more likely a combination of the two to try and get that A1C down. Sometimes these health concerns just need to be managed. Another common one is radiation. We see a lot of people that have been told that because they had radiation, they are not a candidate. There's some truth to that. Probably the better way to say it is that there's risk involved. Our job in that process is if you've had radiation, we want to help you assess that risk. So we'll reach out to your radiation oncologist. We'll find out how much radiation was applied to the area where the implants are going, and then we can discuss what are the risks, what are the benefits, what is it you want to do about that. As you can see from this discussion, if you were told that you're not a candidate, there's a very good chance that you are actually a candidate. It just means that we maybe have to pivot a little bit from our normal and do something a little different, but we don't want you in a denture. We want you to enjoy life to its fullest. And so please come and have that discussion. Thanks for watching. I hope you learned something, and I hope our discussion even brought you a little peace of mind. Please watch another one of our videos and learn more about what dental implants can do for you. We'll see you next time.